Social Value of Disabled People's Physical Activity Report. Using HM Treasury endorsed methodology. Commissioned by Activity Alliance, published in December 2024. National charity Activity Alliance commissioned this report earlier in 2024. With the launch of our new strategy in 2024, we recognise gaps regarding the return on investment and the economic impact of participation in sport and physical activity for disabled people. While many partners are looking at this for the whole population, we knew there was merit in taking a closer look into the data for disabled people. Working with specialists' State of Life, we now have powerful figures that give us and the sports sector more evidence of the value in disabled people being more active. And consequently, the societal cost of inequality. The activity gap. We know disabled people, or those with long-term health conditions, are twice as likely to be physically inactive as non-disabled adults, 41% compared to 21% for non-disabled people. The well-being gap. Disabled people also report lower life satisfaction, 5.7 compared to 7.4 for non-disabled people. In well-being terms, this is a big gap, almost 3 times that of being unemployed compared to employed. Can increased activity for disabled people start to bridge this well-being gap? In short, yes. This study aims to evidence the well-being benefits and social value of disabled people doing more physical activity. We find the well-being benefits of physical activity are greater for disabled people than non-disabled people. Benefit of being active is 3 or 4 times greater. For disabled people, there are substantial well-being benefits in physical activity before the Chief Medical Officer's 150 minutes a week guideline is met. Approximately 2/3 the benefit from meeting the guideline. Putting a monetary value on well-being using the new WellBe. Social value is the quantification of the relative importance of changes people experience in their lives. We follow the UK government's guidance on measuring and valuing social benefits for policy appraisal. Measurement should be based on the subjective well-being measure of life satisfaction on a scale from 0 to 10. Valuation should utilise the WellBe, WELLBY, Wellbeing Adjusted Life Year, a change of 1 point on the life satisfaction scale caused by the intervention of interest, affecting one person over a period of 1 year. it should be valued at £15,300 in 2023 prices. Analysis and attribution. To enable a large sample size, we append 4 years of data from active lives, 2018 to 2022. Attribution is key in this type of research. To what extent is the change in well-being due to a change in physical activity? We use a statistical method, multiple linear regression, which accounts for the influence of other factors, such as age, employment status, or socioeconomic status. The findings are important and eye-opening in a number of ways. The well-being benefit for disabled people meeting the Chief Medical Officer's weekly active guideline, 150 plus minutes, is high. Plus 0.406 in life satisfaction, a social value of 6,200 per person per year, PPPY. To provide a comparison, someone being employed rather than unemployed has a well-being benefit of plus 0.46 and a well-be value of 7,000, 2023 prices. For disabled people, there are substantial well-being benefits and therefore social value in activity before the 150 minutes a week guideline is met. The social value of doing some moderate activity, 1 to 149 minutes, is £4,500, 72% of the value of being active. The social value of doing only light activity is 4,400, 71% of the value of being active. Light activity is where you neither raise your heart rate nor are out of breath or sweating, for example, gentle walking. Does not count towards one's weekly active minutes in CMO guidelines. A person doing only light activity is categorized as physically inactive. This means light activity for disabled people and interventions which encourage this are likely to be an effective way of achieving well-being gains. There is huge value to society if disabled people were as active as non-disabled people. Applying these individual values to estimates of the disabled population in England, 9.1 million, reveals the following. The current physical activity levels of disabled people is worth 35.9 billion in social value. £3.5 billion of this is generated by the 9% of disabled people who only do light activity. Considering them as inactive, in adherence with the guidelines, would therefore underestimate the value. We estimate the activity gap at a cost to society of 10.9 billion. In other words, this would be the additional value if activity levels of disabled people were the same as non-disabled people. You can read the full report on our website, activityalliance.org.uk,